part 3, or maybe it's part 4, the OI Guy slideshow on side effects and extra bonus points for things that just don't involve broken bones, but are tied directly to osteogenesis imperfecta. Last time we left off with heart failure. Seems kind of important, but we stopped there, and we did it for good reason, because a lot of the things that we're going to talk about today have touchstones that are related to each other. Number 6, the big one, being high blood pressure. My father was the first person in our family to show up as an OI patient back in the 40s, and he's had blood pressure all his life. High blood pressure all his life. I've had high blood pressure all my life. Always ask the doctors, hey, does this have anything to do with OI? Of course, the answer was always, oh, no, it can't. My dad was an aviator. He was a photographer. Didn't drink a lot of coffee, but drank a lot of soda. They figured that must be it. I'm Gen X, so of course I mainline Coke and Diet Coke, and so that must be your issue. My poor dad was subjected to every single artificial salt substitute on the planet. Some of it, I think, was just ground up chalk affected his blood pressure. Globally, with blood pressure is, number 1, it's high. Number 2, there aren't a lot of symptoms that are consistent about when things go bad. And number 3, it is the big challenge with blood pressure being higher than average. And with OI patients, it is on a systemic and chronic basis, is you're putting stress on your heart and your pipes all the time. Think about that for a minute, guys, and then think about whether taking 1 or 2 extra pills a day is really that big of a deal, because next we're coming up with something that sounds related but is not directly related, that being pulmonary hypertension. Traditionally, you're not going to see these two both called out in a cardiac event or cardiac case. However, pulmonary hypertension crops up with OI quite a bit because of the challenges we have with our midsections, torsos. As a matter of fact, one of the visual indicators of a patient with OI is a barrel chest. Now, I've always been kind of proud of that, because as far as I was concerned, it was related to my lifting. Yeah, no, maybe not. Maybe just related to breaking my ribs continuously and not getting them treated, because really, there wasn't a whole lot that they were going to do anyway. Pulmonary hypertension is an entirely different animal than the other more common high blood pressure. This is something that goes specifically in and around your chest cavity. The chest walls can be deformed. You might have scoliosis. Restrictive lung disease. I never even thought about this. Was reading a biography recently, and the young lady, OI type 4, is shorter than average, and that restricts her lung capacity. I noticed as my brother moved from walking to living in a power chair, his voice got higher. And that was directly attributable to the fact that his support structure, his skeleton, was melting, shrinking, under the force of gravity, which was compressing his lung capacity. He could not take as deep a breath. That's why I publish a short, quick how-to on the site of deep breathing exercises. If you watch your friends that have got OI, you'll notice they're not doing a lot of deep breathing. And when they exercise, a lot of times they're also not breathing properly. Please keep an eye on that. That's something you want to know about. That's something your doctor needs to know about. Absolutely. Something that is connected to that but not directly related is number 7, which is right ventricular dysfunction. This is an independent risk factor that OI patients have been found with for right ventricular systolic or diastolic dysfunction. And essentially, it's because you are taking the world's largest, strongest muscle, most vital anyway, and you're compressing it. You're putting it in a box, and then you're squishing the box. Just doesn't stand up that well. Following that, structural and myocardial dysfunction, also known as subclinical heart weakness. If you take a muscle and you exercise it on a regular basis, even if you're exercising it to its max, you think it's good, but it's not. The exact opposite is exactly true as well. If you don't exercise those muscles, and your heart is a muscle, and you're not giving it the proper exercise, it's going to get weaker. It's not going to know how to do its job properly. And then when you kick in and you've got an emergency or you've got panic and you need it to work a little overtime, it's going to shrug and go, yeah, boss, sorry, I'm out. So again, these are just a couple of more items. We got one more slideshow coming up on the cardiac system, and then we'll swing around with some questions that you can ask and some tests that you need to ask for. Again, guys, I try to make this as light as I can, but this is not a subject to be taken lightly. This is something that's serious. You want to get with your doctor on it, and you want to make sure everything's the way it should be. OI guy out.